As the Chief Financial Officer of Cape Counseling Services, serving approximately 5,000 individuals in a year, we are concerned through this transition that it may negatively impact those that we're responsible to care for, specifically on our outpatient service line. Based upon our analysis of the new rates, we believe that somewhere approximately 2,000 individuals could be negatively impacted by the change in the rates and the reduction in the finances that we would have to support the unit.
We have a potential problem with the transition from the contract-based system to fee-for-service. Our providers are going to face even greater challenges in delivering their services to thousands of people who depend on them. These services help individuals with mental health disorders, substance use disorders, and in many cases, both types of disorders.
In the fee-for-service transition, I feel that one of the most critical points and vulnerable times of the transition is going from the contract payment over to the fee-for-service payment. For most providers, we have had inadequate opportunities in order to earn and accumulate working capital, which will allow us to pay our bills during this time of the change in the way that the cash and revenue will come into the organization. Because of the inadequate working capital situation, we need some time to transition from the one payment system to the other. Ideally, a 2-year glide path period would be ideal to just lessen the blow of the conversion from one system to the other, and really just allow providers some additional time to adjust their business models and to get used to doing business in this new environment.
Fee-for-service does not cover the entire cost of the providers, and what that translates into is that more than 20,000 people may not have access to care because programs may be closing. This is a vulnerable population, and it's imperative that at small and continuous intervals we see how it's working and make sure that it's working right. And if it isn't, make the necessary adjustments so no one will lose care.
Many residents in our state need our services and do rely upon our services just to get through their daily lives and make things okay. There are some challenges that we as providers are having, and we would like to just work together to lessen the impact of these challenges to keep providing this important care.